Using the NICE guidelines is a step forward in improving patient care. In secondary care, in terms of the hospital, we have been using FeNO testing for many years, which has supported and helped us diagnose both in terms of asthma, but also excluding patients who have other conditions such as COPD, which is chronic obstructive pulmonary disease. In general practice, FeNO testing is not endorsed and supported as much as it is currently in secondary care in the hospital setting. I know from experience in primary care, those practices that have supported FeNO testing with using the guidelines around the diagnosis has definitely helped them support in making sure that it is absolutely accurate in terms of asthma and eosinophilic airways inflammation. It gives you a figure. The figure is very black and white. It's incredibly easy to use in general practice and also within secondary care. It is only one of the key parts, though, that we use as the whole diagnostic suite of tools. So the other tools that we use is spirometry testing, but also fundamentally we need to take a full history. But within that whole body, FeNO will help endorse and support the accuracy of the diagnosis of the patient that you have in front of you. FeNO testing is incredibly easy to use for healthcare professionals to put the whole of the equipment together, ready for a patient to use it. It's putting a power lead and putting in the mouthpiece and the handle and switching the device on. For patients, it's a simple blow. They take a breath in and they breathe out a nice gentle blow for roughly 10 seconds. It is very easy compared to other diagnostic equipment that we currently have and we currently use in general practice, such as spirometry testing. FeNO testing gives me the confidence in making sure that I'm diagnosing patients correctly. And I will give you one classic example. In fact, the last couple of weeks that we've seen a gentleman who came into clinical practice. He had spirometry performed and his spirometry was lower than what we suspected it to be, which it had been roughly the same as what it was before. His FeNO was absolutely normal, but from his clinical history, he was showing signs that he needed further investigation. The following week, we performed FeNO testing again, and again his FeNO testing was lower than what we expected it to be, but his FEV1, his spirometry, had decreased. He was then sent for a chest x-ray and he was later diagnosed with lung cancer. This was a gentleman who had years and years of asthma and he'd been on full treatment for asthma and we presumed it was still asthma, but without the diagnosis and the accuracy diagnosis and the support of FeNO testing to help that whole history taking, that would never have come about. FeNO testing helps you to identify patients who will respond to inhaled corticosteroids or ICS. Some patients who we have seen who have been on high dose inhaled corticosteroid and then performing FeNO testing where their eosinophilic count has been incredibly low and their FeNO testing is very low, we were able to reduce the inhaled corticosteroid measurement, that the dose that they're actually taking. And then conversely, the other group of patients who are presenting with asthma symptoms and who are struggling to breathe, performing FeNO testing will help us to prescribe more accurately to patients who need inhaled corticosteroids. And in actual fact, we probably get more patients that are struggling to breathe and who are what we class as symptomatic and are using a lot of their beta-2 agonists, and then performing FeNO testing is not only helps them to the healthcare professionals to identify that they need more inhaled corticosteroids. It's a lovely measure for patients to actually visually see that they do have airways inflammation and the importance of taking their inhaled corticosteroids when previously and historically they probably wouldn't. They would have carried on with their beta-2 agonists rather than taking their inhaled corticosteroids. Then on subsequent visits, when they come back to see us as clinicians and we can repeat their FeNO testing, they can actually visually see that the airways inflammation has reduced, and that's with both accounts for those that we need to step up and step down.